Welcome to Robert Wood Johnson University Hospital, Somerset's Health Talk. I am Dr. Douglas Oshinsky of RWJBarnabas Health Medical Group. In accordance with social distancing due to the COVID-19 pandemic, I am hosting the show from the studio, and our guests will be joining us remotely via video conferencing. Hispanics are the largest racial ethnic group in the United States and New Jersey and has one of the country's largest Hispanic populations. Due to genetics, cultural traditions, and diet, Hispanics are at a higher risk for some diseases that other groups such as diabetes, heart disease, and certain cancers. During today's show, we will learn more about the unique health conditions facing Hispanic community and how Robert Wood Johnson University Hospital Somerset's new Hispanic Medical Program is working to help promote early detection and prevent increased access to medical care. We are joined today by Dr. Raul Gonzales, family medicine resident at Robert Wood Johnson University Hospital, Somerset, and Manuel Nolasco Munoz, Hispanic patient navigator at Robert Wood Johnson University Hospital, Somerset. Thank you, Dr. Raul Gonzales and Manuel, for being here. First, we're going to be talking about Hispanic and the Hispanic community. So can you both introduce yourselves, give us a little background about yourselves and how you've gotten involved in RWJBarnabas Health Somerset Medical Center. First, Dr. Gonzales, can you tell us a little bit about yourself?
Of course. So my name's Dr. Raul Gonzales. I'm a third-year family medicine resident at Robert Wood Johnson University Hospital in Somerset. A little bit about myself in terms of my background. I was born in Peru, lived there for a good chunk of my life, then moved to Canada, lived there for a chunk of my life, then moved to the US, and I've been here for the past 5-6 years. So I've kind of been all up and down the Americas through the different health systems, different communities. That's just a little bit about myself.
And medical school, before you came to RWJBarnabas Somerset Medical Center?
So I did my medical school at St. George's University, which is in Grenada in the Caribbean. I did most of my rotations in New York and then most recently in New Jersey.
And Manuel, a little bit of information for the audience about yourself.
Good morning, how are you? So my name is Manuel Nolasco. Most people just, I go by Manny. I have a Mexican background. I grew up in the U.S. my whole life, but had a little bit of experience in the pharmacy field. It's my first year actually at Robert Wood Johnson. Very excited to be on board. I attended Raritan Valley Community College, and I'm still in the process of continuing my education. But definitely a good opportunity here at Robert Wood to help the Hispanic community.
Thank you, and thank you for being a nice local resident around here also. It's nice to have locals around. Can you both tell us what you believe the definition of Hispanic community is? Whenever we fill out one of those questionnaires, it always says Hispanic. So can the audience understand what Hispanic really means?
So Hispanic, Latino, it's someone of Cuban, Mexican, Puerto Rican, anywhere from South America, Central America, or any other Spanish culture or origin, regardless of their race.
Thank you. Manuel, any addition to that?
I have to agree. With what Dr. Gonzales said. Anyone from any kind of Hispanic background, whether you were born in any Latin American country or in our case, I guess maybe even European, like Spain, any kind of descendants, I guess would classify as Hispanic or Latino.
Thank you. Dr. Gonzales, now explain to us, the Hispanic community has a lot of health issues that are basically, part of their health issues because of the Hispanic community. Can you explain to the audience, give us an overview of the health issues that are common in the Hispanic community?
Of course. So in the Hispanic community, A couple things we have to look at. We have to look at Hispanic community within the U.S. and also Hispanic community outside of the U.S. because they also face different challenges depending on where you live. Specifically speaking, with the Hispanic community in the U.S., a big thing that we have to that is dealt with in the community is obesity, diabetes, hypertension. We're seeing a lot more chronic kidney disease, and which is likely a complication from these other factors, and as well as chronic liver disease as well. I would say those would be some of the top things that we deal with in this community.
And then a lot of this, unfortunately, is due to the culture of the Hispanic Latino community.
Yeah, so there's many different things that play into why these things are more affecting the Hispanic community. As you said, culture is definitely a big thing, whether it becomes from the type of diet that we eat. Not only culture comes with it, because in the Hispanic communities, we're used to a lot of carbohydrate-rich foods. So that's alone with that kind of diet predisposes us to a lot of those medical issues, as well as some of the other things that this community faces is a lot of the socioeconomic aspects that affect, such as lower income, decreased access to education, decreased access to healthcare. There's also been shown some studies with regards to genetic susceptibility in these populations to such things as obesity and diabetes in itself.
So again, we have both environmental causes as well as genetic causes.
Yes, I would say both of them play a good mixture and make up what cause these problems.
And again, the Latino Hispanic community is a very family-oriented community. And therefore, if their diet is, as you had discussed, higher in carbohydrates, that will possibly increase the risk of diabetes, high blood pressure, and obesity, which are common in that community.
Yeah, diet plays a big role into it. I think within that diet, the socioeconomic aspect of lower income that this community faces plays a role in not having the availability of getting those nutrient-rich foods because they are more expensive. Those grains, which are needed within our diet, and we try to focus more on the cheaper foods because they're easier to access. They are within our community as well, such as the grains that we cook into our food. We eat lots of rice. That kind of meals in itself are culturally predisposed into us.
So it's the culture. It's also, unfortunately, the lower socioeconomic status with the inability to obtain the foods that may be of higher quality because of the cost of living.
Yes, correct.
And so do you have, Manuel, you're a nurse navigator as part of RWJBarnabas University Hospital, Somerset. How can we help this community to reduce these conditions?
One of the biggest things I think we could do is definitely health education. Overall, just, information about nutrition. We currently have, programs that are available. I think outreach is, part of my goal right now, just to let the community be aware of the kind of programs we offer here. But that's step number one. I think it's a big step to take on. As far as a medical perspective, I think that's the best we would be able to offer.
Well, I think you have actually more to offer, such as the fact that you're bilingual and can speak the language. Language does have a big part of what's going on with the problems in the Hispanic community is that many of the people are only speaking their native language, and when they come into the health system's not helping them communicate with the providers, with the community, etc. And because of people such as yourself and Dr. Gonzales, who are multilingual, you're able to help direct the people into the right facility, the right place, the right providers.
Mm-hmm. Right. That's a given within the program. So probably one of the services, but the biggest service I have to this day provided has been the in-person translation in the, at the bedside in the hospital, navigating through the hospital. But we also help them set up appointments, maybe refer them to some doctors they might have not been aware of, or, if they've been discharged at the bedside and they don't understand what's going on, it can be difficult to follow up on your care. So that's what, the Hispanic Medical Program is there to do, help the patient.
So again, it may be something that may not be stated, but it's actually a very important aspect, is the language barrier. If someone is discharging a patient from the hospital who's of Hispanic origin, and the physician, provider, nurse, etc., is not translating it into their native language, whatever they're saying, they're not going to be able to communicate well with the person, and the person may not even understand what the follow-ups are.
Right.
So
just to jump in there, I think that's a very good point that you bring up. I see this all the time on a regular day-to-day basis, because we follow up in my office, in our clinic. We follow up a lot of Hispanic, Spanish-speaking community, and sometimes, like you said, if we have like Manny said, we have lots of great translation services. I think the hospital does a great job in terms of trying to communicate, getting other navigators involved, but it's not always as simple and as available as we would want it to be. And sometimes within the communication aspect, sometimes patients get a little scared, shy, or they don't know with regards to communication. And sometimes there's a lot of things forgotten, possibly at discharge, not all the right medications, not the right instructions are always conveyed. And the hospital does a very good job in terms of trying, but without having that one-to-one direct kind of communication, sometimes some things can get missed.
Which again is so important. The fact that you are multilingual, the fact that Manuel, as a Hispanic patient navigator, can help the translation, even just the names of the medications, the doses of the medications. If we don't get that correct, they're going to end up back in some type of severe problem.
Of course, yeah, and we sometimes, unfortunately, that does happen. We try to avoid that as best as possible. I think, like I said, our hospital and our clinic try to do our best to communicate everything with not just communication in itself directly with the translator. We also provide a lot of materials in both English and Spanish, paperwork in English and Spanish, so people could have it, and they don't just rely on kind of these foreign language just to rely on nothing. They have something that they might be able to relate to and can read to, even though medical comprehension might not be the best in the community itself, which is another barrier to kind of overcome. But having that Spanish first, or at least for myself, being a Spanish first provider, it does make things a lot easier.
And the fact that it's being done by a personal person and it's not a computerized person. It's not that I'm using a language line over the telephone and we're trying to go back and forth between me and you. It's the fact that you are actually there at the bedside, and Manuel is actually there to be able to communicate with them.
Of course, it helps a lot, and it makes a huge difference, I believe.
Now, Manuel, can you tell us what your role as the Hispanic patient navigator is, and even explain to the community what a patient navigator actually is? I don't know if people actually understand what that means.
Of course. It's a fairly new program for the Hispanic community, but as a patient navigator, I basically assist the patient with a variety of services. At the moment, it's all inpatient services, but I help them, with translation at the bedside, within the hospital. I can help them navigate through the hospital if, they might have an appointment and they don't know where to go exactly. I can help them with filling out paperwork. I can help them, understanding the discharge plan or their overall plan within the hospital. But anything I could do to just make their, typically stressful visit or, experience just hassle-free as possible.
Now, what you do, again, is you give them that personal touch in their own language. You're able to explain to them what's what, and you're basically the person who they can trust to help them get through the system.
Correct. I think it's important, especially on a cultural level, just to feel comfortable with who's helping you. You can have someone translating for you all you want, but if you're not understanding the material, what's being told to you, you're at risk of just coming back into the hospital. I understand, and overall, comfort for the patient.
Again, it is so important, the personal touch that both you and that the hospital do for this community.
I try to connect everyone in the room as well as I can to make the patient feel, cared for.
It's just nice to have one central person such as yourself helping to basically be that person that they can always get in touch with if there's a problem.
Right.
Now, can you tell us about some of the programs that RWJBarnabas Health Somerset Medical Center specifically have for the Hispanic community, such as the El Poder sobre la Diabetes program?
So El Poder is one of the good programs we have here. It's a diabetes education program. So it helps you, it helps with prevention and then just reducing the risk of diabetes for the Hispanic community. We also have the Senos Sanos program, which is offered, in collaboration with Crossroads for hope to educate Hispanic women about the prevention of breast cancer and encouraging mammograms within the community. And then obviously now we have the Hispanic Medical Program available to all patients who seek it.
So again, RWJBarnabas Health Somerset Medical Center provides this, and they've been providing both diabetes education and mammogram and women's prevention health for the community. But what they've now done is that they've now done a specific part of that for the Hispanic community to be able to help them in their own native language as well as the cultural characteristics of the patient.
That's right, yes.
And the screenings, can you tell us about some of the screenings that that we've done for the Hispanic community, such as the Salud BRG and the community? Can you describe those and explain to the audience about those?
Yeah, so the Salud BRG and the Community Health Department during COVID, they actually distributed masks and hand sanitizers, overall health information within the Hispanic communities. Recently, they just partnered up with Bound Brook Schools for flu shots. The hospital has developed a Latino Advisory Council with community members to help address the health needs in the community. And we also hold various webinars in Spanish and English over, a variety of health topics.
So again,
But,
what you're doing is you're trying to bring the large organization into the Hispanic community itself.
Correct. Mm-hmm.
We're trying to personalize it. We're bringing it out to them also, so that they don't have to worry about coming into the large organization to get it. Such as, again, the distributing of masks during the COVID, and what you just described, bringing the flu shots out to Bound Brook in order to give them out.
Yes.
Also, the webinars that you described, which are in Spanish, which will help the people communicate and understand the what's going on with their health.
Correct.
And then there's also the Proud Center, which is reaching out to the Hispanic LGBTQ community, also to help promote education and HIV prevention. Can you just talk a little bit about that?
Yeah, so we always collaborate within departments. These events are always good, like you were saying. We go out into the community to kind of let them be aware. At the same time, they can meet members of the Hispanic Medical Program, so they can get a feel for them, get some, information, maybe some contact information. That way, they feel more comfortable coming into the hospital, even after meeting us within their, own community. So I think it's good events we host.
And we've done stuff with the Proud Center, which is important for the LGBTQ community. Correct?
Correct, yes.
And again, promotion of HIV prevention, again important, not only in the population itself, but also in the Hispanic population also.
Yes.
Okay, so what would you both say to the members of the Hispanic community who are hesitant about coming into the hospital or seeing a physician, provider, nurse, how do we get more of them to understand what RWJBarnabas Health, Robert Wood Johnson, Somerset Medical Center is doing to help the community?
I would say don't be scared. I know health is always a scary thing for patients in any kind of community. And the Hispanic community can be even extra scared because they're concerned about not understanding things, not being able to pay for things, not being able to follow up or anything like that. So a lot of times those are some concerns that they have, which I always like to convey. Don't be scared. There's lots of resources, just as Manny was mentioning, that hospitals and specifically Robert Wood provide to be able to navigate any of those issues. And so if you have any health concerns, if there's lots of screening aspects, there's lots of availability to get in touch with medical professionals as well. So I would say don't be scared, even though health is a very scary thing. There's lots of things we can do to make the experience a lot better for them.
And anything from you, Manny?
I'll follow up on what Dr. Gonzalez said. Health is a very scary topic, but I always try to tell people to put their health first. Worry about the other things later. We can help you with it, and we have a lot of resources, whether, it might be financial or overall fear. Like, the language barrier is a scary portion to it, adding on top of the health issues. So I want to just, advise this, or, let the Hispanic community know that we're here to help them.
So again, health is always number one, family number two. And what the two of you are showing us is RWJ Barnabas Health, Robert Wood Johnson, Somerset Medical Center is doing everything possible to help the community understand, educate, and get them involved. And the fact that we have people such as yourself, Manny, as a Hispanic nurse, patient navigator, will help them get through the system as best as possible.
That's right.
Yeah, I think Robert Wood Johnson has done a great job in terms of the outreach about making things available to the Hispanic community, especially after COVID in itself, too. They've done a great job with it, which is very good to see nowadays.
So how would patients access the Hispanic program?
Best and easiest way to access is literally a phone call. I have a direct cell number that patients can access. It's free of charge. Any patient who seeks information or help can literally just call me or text me, and that's the best way. Do I put the phone number here?
You can do it.
So the phone number is 848-230-5002. That's a direct cell phone number. Like I said, there's no assistant, no automatic call. It's straight to me. Any information, even if you're not here, you just want information about coming to the hospital, give me a call, give me a text. We'll talk it over. If you're in the ER and you're, right there, you're struggling with the language, just give me a call. I'll run over to your room, wherever you are in the hospital, and we'll help you out.
Terrific. That's exactly what the community needs to hear, that we have people who are available 24 hours a day, 7 days a week, who have a similar culture, similar lifestyle, and can speak the language, can help them navigate through this hard system. Especially after the last 2 years of COVID, everyone is scared. And what you're going to do is you're going to reduce that scariness and allow them to obtain the best possible health. And through the use of people such as Dr. Raul Gonzales, who are terrific family medicine residents, get them through the system, get their education, get their health as best as possible.
That's right.
And Dr. Gonzales, do you have anything to say also about how we can help the Hispanic community?
Like Manny was saying and how you were touching up on, prevention is always key. The more we can get ahead of a problem or an issue, the easier it is to solve. So all these outreach programs, whether it's within the Proud community, whether it's within the Hispanic community, really do make a difference overall. All these screenings help us kind of go through, see anybody who might be at an increased risk of any of these other issues. So maybe they'll be able to be more inclined to visit a provider, and then we can kind of take over there, see what kind of management we can do and help from there.
And actually, you have to give yourself a little hand yourself. You are an excellent physician provider itself who give excellent care, follow screening guidelines. And if people can get in touch with a provider such as yourself, we can help them get through any medical issue necessary and get them to the appropriate specialist if necessary.
Absolutely. As complicated as the problem may be, there is always a way we can try to help out or try to find a solution for them. As a network, I think we've done a good job for that, to be able to put providers in touch with other providers, patients in touch with other providers to kind of help regardless of what the problem is, whether it's something very simple to something very complex.
And the fact that we're all going to a single EMR, which allows us to obtain all of the data from our hospital, from RWJBarnabas in New Brunswick to RWJ in St. Barnabas, that we're going to be able to access everything possible to give them the best possible care.
Of course, I think that's a very good thing you touched on, because overall Central Jersey in itself has a very big Hispanic community. So it's very common for a patient to have to see a provider here or there, where the housing situations move around. So that way we could keep one EMR, and overall as a network, we can provide seamless care.
Dr. Gonzales, do you want to say a few things in Spanish directly to the Hispanic community who may be watching the show?
Of course. La primera cosa que yo les diría es de no olvidarse de su vacuna para el COVID. Es algo que siempre recomendamos a todos los doctores. Hablen a sus doctores para ver si ustedes son candidatos para ponerse, que bastante personas son. Ahora ya estamos haciendo el booster para bastante personas. Aparte de eso, chequeen su dieta todo el tiempo. Ese es el más simple cambio que podemos hacer de siempre en nuestra comunidad. Y por favor, si necesitan alguna ayuda, pueden venir a nuestra oficina. Nosotros somos Somerset Family Practice y le podemos ayudar ahí.
Thank you. I actually understood most of what you said, but thank you. Manuel, do you also want to say something in Spanish directly to the community? And again, if you want to announce that phone number, you can add that also.
Absolutely. Pues le quiero decir a todo el público, a toda la comunidad, que por favor cualquier duda, cualquier información que necesiten, por favor, denme una llamada, un mensaje de texto. Otra vez mi número 848-230-5002. Número directo, acceso directo, no tengo ningún recepcionista, nada. Me hablan directamente a mí, cualquier pregunta, cualquier duda, o si simplemente ya están en el hospital y necesitan ayuda, por favor háblenme. Con confianza, todo lo que usted me platica se queda entre nosotros. Tenemos reglas de privacidad. Por favor, le urjo que me hablen, por favor, cualquier información que necesiten.
Thank you, Manuel, and thank you, Dr. Gonzales. Thank you both for everything that you do, both medically, clinically, socially, and culturally. You give all to the community, to medicine, to the Latino community, as well as the full community that RWJBarnabas Somerset Medical Center exists in. People such as you need to be praised, lauded, and we're thrilled to have you as part of our community. Thank you very much for both of you being here.
Thank you very much, and thank you for having us and giving us an opportunity to reach out to the community as well.
That concludes today's episode of Health Talk. Please remember that the opinions expressed here today by our medical experts are not a substitute for medical advice from your own physician. If you need a physician, please call 888-724-7123. For more information about the Hispanic Medical Program at Robert Wood Johnson University Hospital, Somerset, and healthcare resources for the Hispanic community, please visit us at www.rwjbh.org/Somerset Latino Health.